My name is Alex. I'll be demonstrating how to administer a mini bag medication today. So I've already compared the physician's orders with the MAR. They are the same. The reason for the order makes sense. The physician has signed the order, so I'm going to put that one away. So the patient has no past medical history. He was stung by a bee, got it infected, and so now he has an infection, a cellulitis infection in his arm. He is allergic to walnuts. The patient's name is Valgus Volt, and we'll be giving him Pengy sodium. So I'm going to first wash my hands. I'm going to check the expiry date on the vial, so this one is not expired. First check is the vial with the MAR, so right patient Valgus Volt, right drug penicillin G sodium, right dose 2.5 million units, so 5 million units, we know that we have enough in this vial. The dose is IV, so for IM or IV use, it says here, the time is now, we are giving it every 6 hours. Okay, so looking at the MAR, we see that it is an antibiotic. It's administered by a student nurse. Maximum single dose is 5 million units, so we're okay. Maximum daily dose is 30 million units. I did the calculations and that's also okay. The reconstitution, we're looking at the 5 million units vial here. We're going to reconstitute with 3.1 milliliters of, I chose normal sterile water. There's other options as well. Final volume 5 mil, and we will look at the other information later. Compatible with normal saline, which is what is running for our pump, as well as some other things. And we're watching for CHF, rash, electrolyte imbalance, anaphylaxis, etc., coma, seizure. So we will watch for those. Okay, so it's time to sort of set up my supplies now. And my syringe. So I will swab the vials for 30 seconds. I might use 2 swabs. Just going to use 1 swab for the purpose of the video, save time. Okay, so let it dry for 15 seconds. I'm going to assemble my syringe now. Okay, so with my needle, sterile technique. Good. Okay, so we need 3.1 milliliters of sterile water, so we're going to inject about that much into our sterile water container and withdraw 3.1, so a little bit more to account for air bubbles. Okay, scoop technique. Okay, that honestly takes more time than to just push with my finger. So, no air bubbles. What time?
3:39.
So just a little bit past the 3 there. Okay, good. So there's no air bubbles. We're going to instill that into our vial now, 3.1, 3.1. So we should have a final volume of 5, but we will not have that. So my needle was okay, didn't touch anything. Gently roll because we don't want to get bubbles in the med if we roll vigorously. Okay, so now I'm going to do my calculation here. So final volume of 5 in there. So concentration 1 million units per milliliter. We need 2.5 million units for our dose desired. So we divide 2.5 by that 1 over there. Each of those are million, and we get 2.5 milliliters. So I'm going to draw my dose now.
The maximum daily dose is 12 grams or 12,000 milligrams. And then
So, good.
maximum daily doses that we were giving was way low below the maximum daily dose of sodium.
Okay.
So, I will be reconstituting the one.
So just after that
I will be
second line there,
reconstituting
that should be 5.
oxycyllin,
No air bubbles. Okay,
with
so that is our dose right there. Our second check is vial, syringe, MAR. So right patient, Vegas volt, right drug, penicillin G sodium, penicillin G sodium. Right dose 2.5 million units. We will recalculate that. So 5 million units. It's good. We have 2.5 here. Right route IV says that here. Right time is now to recalculate to make sure. We can even do 5 million units, so we want half of that with the 2.5.
6 minutes.
Volume. It's been 6 minutes? Okay, good. So basically we want half of that volume of the 5 mil. So 2.5, which is what I have here, or we can do it with the concentration. So 2.5 million units was desired divided by the concentration of 1 million units. We